This lecture is presented by Dr. Frank Schallenberger. Dr. Schallenberger has been trained in traditional medicine and is licensed as a medical doctor. He has also been trained in alternative and homeopathic medicine and is additionally licensed as a homeopathic medical doctor. Dr. Schallenberger graduated from the University of Maryland School of Medicine in 1973 and has been integrating the best of alternative medicine with the best of traditional medicine since 1980. He has authored several scientific and clinical papers, as well as 2 popular books which can be found at all of the major book outlets. He is also the editor of the Real Cures newsletter. Dr. Schallenberger is the medical director of the Nevada Center for Alternative and Anti-Aging Medicine in Carson City, Nevada. This lecture was recorded on August 7th, 2009.
Hi, I'm Frank Schallenberger. I'm a medical doctor. I'm licensed both as a conventional medical doctor and also as a homeopathic medical doctor. And I started my career almost 40 years ago in surgery and in emergency room medicine. And then very shortly into my career, I learned about natural healing. I became intrigued with the idea of natural healing and subsequently received training in that. And my life as a professional has been devoted to working with my patients, to helping their bodies heal them of whatever illness or problems they have. The thing I want you to know is that your body was designed by God to heal itself. That's right. It wasn't, God didn't make this body and then send it out and say, go get some drugs when you need them. We are actually endowed with systems in our bodies that diagnose and treat all medical conditions, every medical condition from cancer to flu to if you break your bone, you don't need surgery, you don't need a medication, you just need to follow what your body does and it'll heal that break. So your body was made to heal itself. True, there are some times when we do need surgical intervention and we do need medications. There's no doubt about that. But in general, I want you to understand this. Your body was endowed with systems that not only diagnose why you're sick, but actually fix the problem. So as a homeopathic medical doctor, I have, over the years, tried to use that as much as possible. Sure, I understand that there are times when surgery or drugs are needed, but my thrust is to find out what I can do to help your body heal itself of whatever disease you have, whether it's cancer or it's chronic fatigue syndrome or whatever you're facing. Now today, I'm going to talk about two of the most critical and overlooked factors by medical professionals on both sides, by conventional medical doctors, by alternative medical doctors. These two things are just grossly misdiagnosed and overlooked, and they're probably the two most critical factors that your body needs to get well in virtually any disease you're dealing with. And that has to do with managing your thyroid and your adrenal glands. And so in the course of this lecture, I hope you understand that one of the reasons people get sick in the first place and go see a doctor is that their thyroid and their adrenal glands are not working. And one of the reasons patients fail to get well, even in spite of all the good things they may be doing, is because this diagnosis of failing adrenals and failing thyroid is often missed and or not adequately treated. Let me put it to you another way. When your system gets stressed, your body has capabilities of dealing with that stress. In order to deal with the stress, it makes hormones. It makes adrenal hormones primarily, but it also makes thyroid hormones. This sort of keeps your boat afloat. Everything's working pretty well. But as soon as your body isn't able to keep up with the demand, so the stress may be so great that the demand for your adrenal and your thyroid output is exceeded, and your adrenals and your thyroid just can't keep up with it. That's when things start to break down. So I have sort of a general rule, and my general rule is this. How do I know if a patient needs adrenal or a thyroid support? I know because they walked in my office. If they didn't need adrenal or thyroid support, they probably still feel pretty good no matter what stress they were under. whether it was a flu or whether it was arthritis or whatever, they'd probably still feel good and wouldn't feel the need to see a doctor. So this is an extremely prevalent problem, and one that you'll see is just very, very underdiagnosed and undertreated. So I want to explain some of these misconceptions to you, and we're going to go through this today. How to know when your adrenal is depleted, how to know when your thyroid is depleted, and what to do about it. First of all, we're going to talk about the hormone cortisol. Cortisol is the most important hormone in your body. You absolutely need cortisol. Your cortisol level goes to 0, you go to 0. It's the most important steroid hormone in your body by far. There's nothing that comes close. I'm sorry, insulin isn't as important. Thyroid's not as important. Nothing is as important to your survival and your well-being and your body's ability to deal with stress than the hormone cortisol. Cortisol is also known, by the way, as hydrocortisone. So if you see the word hydrocortisone, that's referring to the exact same hormone as the hormone cortisol. Cortisol has unfairly received a very bad reputation. So bad, in fact, that doctors are just flat out afraid to supplement their patients when their patients have cortisol deficiency. Now, I don't know why. I think it's crazy. If you got an estrogen deficiency, we give you estrogen. You got a DHEA deficiency, we give you a DHEA. You got a thyroid deficiency, we give you thyroid. We don't think too much about that. But for some reason, when you get a cortisol deficiency, whoops, we can't give you any hydrocortisone. Can't do that, even though it's the most critical hormone in the body. I think this bias primarily comes from the fact that there's a lot in the literature about cortisol excess. There's a disease called Cushing's disease, also known as Cushing's syndrome, where there's cortisol excess. And this disease is very debilitating, it's very terrible, and I guess the thing that the doctors get confused with is that if you give a patient hydrocortisone, that somehow you might give them Cushing's disease. It's just, I've never seen it happen, but I'm thinking that's the bias, because there is this bias against cortisol. So let me just expose the myth of cortisol excess, okay? All stressful conditions begin with cortisol excess. As soon as you get stressed out, whether it's from a flu or from a cold, your body makes a lot of hydrocortisone. Why? Because it needs it. That's why it makes it. It's not like your body's stupid and saying, you know what, I don't have anything else better to do today, and old Frank is stressed out, so let's just make a whole heap of hydrocortisone and then think of something else. No, it's making that hydrocortisone because that's what keeps me healthy. It's what keeps me well, whether I'm fighting a virus or whatever I'm fighting, okay? So all stressful conditions begin with a cortisol excess. But with rare exception, by the time the patient is seeking medical condition, that cortisol excess has become a cortisol deficiency. Now let's take a look at why that is. Let's look at this concept of adrenal sufficiency. When I talk about the adrenal gland, I'm talking about the gland that makes hydrocortisone. It also makes other hormones, one of which I think we'll touch on, called DHEA. But the primary one that we're going to focus on today is the one that is so often depleted, and it's called hydrocortisone. Life in the fast lanes, and all the lanes are fast lanes. Have you noticed that the world's becoming a more stressful place? Have you noticed that you have more electronic gadgets you have to deal with? Have you noticed that the news is becoming a little bit more stressful? Have you noticed that it's harder to deal with life these days than it used to be in the old rural communities 100 years ago? Have you noticed anything like that? Have you noticed that our environment is getting bombarded by thousands and thousands of new chemicals released every day? Have you noticed that our bodies are constantly bombarded by the invisible electromagnetic radiation coming from cell phone towers, coming from cell phones, coming from wireless phones, coming from 24-hour wireless internet services? Have you noticed these things? Have you noticed how the air has become contaminated with all kinds of pollutants? Have you noticed this? Have you noticed that due to international travel, we're all getting exposed to viruses and bacteria that we just don't have any immunity to? Have you noticed this? I think you probably have, okay? We're all under a tremendous amount of stress. Some of the stress is obvious and we see it, and some of it's not so obvious and we don't think of it, like maybe a cell phone stress. But our bodies are under a tremendous amount of stress they were never meant to be in. So life in the fast lanes, and in our world, all the lanes are fast. It's pretty hard, unless you're a monk on a mountain somewhere, to be in a situation where your body's not getting continually stressed. Just look at some of the factors. There's all this complexity in our lives. There's very little time to do what we need to do. We always seem to be hurried. We always seem to be behind the 8 ball. There's this whole idea of genetics and your adrenal reserve. What that means is that certain people, their adrenal glands can pump out a ton of hydrocortisone. You know people like that. You might even be a person like that. You know, where stress doesn't bother you. You can miss a night's sleep and you're still performing. Well, young people are a lot like this. They can eat terrible things, they can smoke, they can carry on, they can do all kinds of things that you know, to this 63-year-old man, it just put him in the graveyard real quick. But they can do that and they get away with it because they have very strong adrenal glands. They can pump out enough hydrocortisone. But as we get older, we can't pump out as much hydrocortisone. And some of us are born with an inability to make enough hydrocortisone to deal with all this tremendous amount of stress. So for those people, this lecture is particularly important. And I'm going to tell you who you are in a second here. Coping bankruptcy is sort of like, you ever get the feeling if one more thing happens, I'm just not going to be able to deal with it? These are common things. We all experience this in some way or another. Children and young people very often have weak adrenal glands. Our kids are getting stressed out, not just us. And then there's this vicious cycle thing. We see this stuff all the time. You got your stimulants like your coffee. You got your high glycemic carbs like your donut. You got anxiety, and then you get anxiety over being anxious. And then you get insomnia because your anxiety over being anxious and you had too much coffee that day. And because you got insomnia to get a good night's sleep, you need more coffee to take care of that. And oh yes, that donut makes you feel pretty well. And then you kind of get depressed over this. And then you get depressed over being depressed. And you know, how many of us can't relate to some form of these kinds of things going on? You might have to rely on medications, you might have to rely on meditation or whatever it is. But this is stuff that we all face. And this is why I want to tell you, it is so common. If you're a patient and you're trying to get over a disease and you're not thinking about your adrenal gland, odds of you actually getting well aren't real good. Let's look at what the adrenal is supposed to do. This is a healthy adrenal response. So here's the cortisol, here's the hydrocortisone over here, and here's time over here, and here's baseline. So baseline means, you know, when everything's going okay and there's no problem, that's about the amount of hydrocortisone you make. And normally in a human being, that's in the order of 20 milligrams a day. So in the average human being who's not particularly stressed out, somewhere around 20, 30 milligrams a day is what their adrenal gland is going to make in terms of hydrocortisone. But along comes a big stress. Something happens and stresses that system out. It could be bad news. It could be a virus they got exposed to. It could be a physical thing like not getting enough sleep. It could be eating a food that was contaminated in one way or another. Anything that's stressing your system. Here's the stress. Your body makes just oodles of hydrocortisone. Instead of making the 20 or 30 milligrams, it may make 180 milligrams during this stressful period. But that's okay. That's what it's supposed to do. The extra hydrocortisone keeps your boat afloat, keeps you alive, helps you resist the virus, keeps you strong, everything's fine. And then as soon as the stress goes away and you get over the illness or get over the problem, you go back down into a lower level of cortisol until it's completely gone over, and then you revert back to your baseline. So this is a very healthy adrenal response. An initial high reaction to cortisol to stabilize things, a higher level than baseline to keep things going until you finally get well, and once you get well, you don't need it anymore. But that's not what happens in modern day life. This is modern day life. Modern day life was, the alarm was sort of, I don't know, you got up one morning and you went out, or you graduated from high school or medical school or whatever you did, and you went out into the real world and you started getting stressed, and guess what? It never stopped. You're continually stressed. Either stressed by, like I'm talking about, like environmental things, or you know, you're getting older, you've got children, you've got jobs, you've got spousal relationships, you've got all these issues going on, too many irons in the fire. You never get over it. So you have continuously elevated levels of cortisol. Okay? This is called the general adaptation syndrome. I call it modern life. This is where we live, folks, right in here with excessive amounts of cortisol to deal with all this stress. But as long as your body's healthy, it can deal with this. And this is not necessarily an issue. But here's the problem. You can't keep this up forever. We all have what we call an adrenal reserve. That it basically is a way, it's like a bank account. We all have so much hydrocortisone per day we can make. And if you exceed that, if you withdraw too much money, you're going to run over balance. And that's what we do with our adrenals. So over time, here's what happens with people. As they're making this amount of cortisol, they're in their adaptive phase, and they feel pretty good. And this can go on for years. But at some point, something happens. It could be something simple like a virus or a flu that ordinarily they would have gotten over. It could be they had a surgery. It could be their doctor put them on birth control pills. It could be that they received bad news. It could be that they moved into a new house and they happen to be allergic to the carpets. It doesn't make much difference. It doesn't have to be a big thing is the point. They're already overloaded here. A little thing comes along and just pushes them right over the edge, and now their adrenal gland cannot make enough hydrocortisone to keep up anymore. And the hydrocortisone levels actually go down as the adrenal becomes exhausted. And the levels go down, actually at some point they go right down below baseline. And this is where Hans Selye, the scientist that first discovered all this effect of stress on our systems and the effect of cortisol and such, he called that the exhaustion phase, where now you still have the same amount of stress, but you can't make the hydrocortisone to deal with it. I call it, it's the time to see the doctor phase. Because as long as you're making enough hydrocortisone, keeps your boat afloat, you're okay. But as soon as this thing happens and you go into this exhaustive phase, now you can't make the hydrocortisone, now everything falls apart, and you go into that thing we just kind of talked about, where you're in adrenal fatigue. And this is what I'm telling you. So many patients are in this state when they see their doctor. And yet the doctors either completely ignore it or they don't give adequate treatment for this because they're scared to give their patients hydrocortisone. And I can just tell you, I could tell you literally hundreds of stories of patients that have come to see me for chronic, long-term problems, anywhere from lupus to rheumatoid arthritis to other, like chronic fatigue syndrome, fibromyalgia, chronic headaches, anything. It's unbelievable. That have seen a who's who list of conventional or alternative doctors, the best of the best, and have gotten nowhere until I put them on adrenal therapy. And then all of a sudden, the lights turn on, but that's what it's like. There's no way, I don't care how every little part of your healing mechanism is in place, but you're hydrocortisone deficient, there's no way you're going to get well all the way. You might feel better, but you are not going to get well until you plug in that hydrocortisone. So, how do you know if you have this? Well, let's go over these symptoms because you're going to see, most of the people probably listening to this right now have a degree of this. That's how common this is, okay? Well, I give lectures to doctors, and so I ask the doctor, how do you know if the patient, if a person has a need for hydrocortisone, they're hydrocortisone deficient, they're sitting in front of you. Okay, that's just a facetious way of saying this is extremely common. Well, they have weakness and fatigue. That's the most common symptom, and it's especially in the afternoon. So if you feel fairly good in the mornings, you have your Starbucks and you're kind of coasting, everything's pretty good in the morning, but you do the crash and burn number around 2 to 4 p.m., you have adrenal fatigue, you have hydrocortisone deficiency. Bing, that's all I need to know. That is a pathognomonic slam dunk diagnosis. Now, even if you don't have that, you might have the problem. If you're fatigued in the morning and it gets worse in the afternoon, then you just have a worse problem. But that afternoon crash and burn number, that's pathognomonic of hydrocortisone deficiency. Now, some patients won't report that because, they have a Starbucks around 1, 2 p.m. and that takes care of it and they feel great. But if you didn't have that coffee, that's what I'm talking about. How would you feel? If you have decreased coping ability, or if you have to have crutches, if you have to have alcohol, if you have to have that sedative, if you have to have things to calm you down or the anti-anxiety medication, odds are really good you have adrenal insufficiency and you need some hydrocortisone replacement. Hypoglycemia, low blood sugar. Hydrocortisone is the hormone that keeps your blood sugar up. So if your blood sugar falls, bang, guarantee you, you have a hydrocortisone deficiency. Carbohydrate craving. When your blood sugar goes down, what are you going to want to eat? You're going to want to eat something that makes your blood sugar go up. What's a really good thing to do that? Say candy, something with sugar, something very bread-like, some chips, some cookies, all those things that we all crave and we all want, especially in the afternoons because the blood sugar's down. That's a real sure idea that you have a hydrocortisone deficiency. If you find that you're drinking more and more coffee, you started off with 1 cup a day, that's pretty good. And next thing you know, you're like the patient I saw yesterday, he's on 6 cups a day and didn't think anything of it. Everything's just fine as long as he's on 6 cups a day because it keeps stimulating his adrenal to make hydrocortisone. But this is not a healthy situation. It's much better to give yourself hydrocortisone, stop the coffee, and let your adrenal gland heal. Mood swings, headache, insomnia, allergies, big thing. So allergies, and by that I'm including all autoimmune diseases, by the way. But allergies to dogs, cats, pollens, all of those kinds of inhalant allergies are manifested by a deficiency of hydrocortisone. And likewise, they can be cured when you replace the deficiency. Adrenal panic attacks are huge. Here's what happens. When you're under stress, your adrenal gland has a choice. It can make the really nice hormone that feels you good, makes you feel good. That's called hydrocortisone. Or it can make the really bad hormone that makes you feel terrible. That's called adrenaline. But in either event, those are 2 hormones that it can use to keep your boat afloat. It prefers to make hydrocortisone because that's the nice mellow hormone, makes you feel good, makes you feel satisfied, everything's good. Adrenaline makes you feel terrible. But if you can't make hydrocortisone, then it has to rely on adrenaline. So now it's going to pump out adrenaline. And when you get adrenaline, these are kinds of the symptoms of adrenaline. You get tachycardia or a rapid heart rate, that's what that means, dry mouth, perspiration, nausea, lightheadedness. You often feel breathless. You feel like you can't breathe. You can breathe, but you feel like you can't. You're trembling and you have this sort of out of control kind of feeling. This is classically diagnosed as a panic attack, and it's caused by excessive amount of adrenaline being secreted by the adrenal gland because it can't make enough hydrocortisone. Hydrocortisone will cure panic attacks. So if you see these kinds of symptoms, you stand in line. You need some hydrocortisone. There are other ways that doctors can use to kind of determine if you need it. In my book, though, if a patient walks with any one of those symptoms, I'm going to give them hydrocortisone and see if they don't get better. If they get better, and we're talking in a matter of 2 or 3 days, if they get better, then I know that's my diagnosis. I don't have to go into the rest of this. But just so you know, you can look at your blood pressure. When you take your blood pressure laying down, you go to stand up. If you have good adrenal glands, the blood pressure actually gets higher when you stand up. If your adrenal glands are bad, the blood pressure will get lower. So that's one way to determine it. Hypotension or orthostatic hypotension. Hypotension means too low a blood pressure. Orthostatic hypotension refers to a blood pressure falling when you go from a sitting to a standing position. So if you notice that when you're sitting down and you get up or you're bending over and you go to stand up and you get woozy and kind of lightheaded, that's a pretty good sign that you have hydrocortisone deficiency. You can look at your blood tests. If your sodium is a little bit in the low range and your potassium is a little bit in the high range, that's a sign. Pupillary response. When you shine a light into an eye, it should constrict, and it should hold that constriction if you're having that light shine in that eye. That is controlled by hydrocortisone. So in hydrocortisone deficiency, what happens is the pupil goes down, but it immediately opens up. You can't hold it. So that's another way to check it. And then finally on the blood count, you'll see an elevation of these cells called eosinophils. We test for these all the time, and we see high eosinophils probably 50% of the time with our hydrocortisone deficient patients. Now, you can almost look at somebody in the mall and determine just by looking at them whether they're likely to be hydrocortisone deficient. Certain body types are really prone to this. I'm one of them. Just so you know, I'll go on record, I take anywhere from 20 to, say, 30 milligrams of hydrocortisone every day of my life. Been doing that for probably a decade now. I'm healthier than heck. I got nothing wrong with me. By the way, all those people out there that think hydrocortisone is a poison and everything, it's not. The reason it's not a poison is your body makes it. So how bad can it be? It either makes enough or it doesn't make enough. If it doesn't make enough, take some. build up the amount. Anyhow, people who are thin, that would be me. People who are white, fair, that would be me. I used to have red hair. Blue-eyed, that would be me. Females in particular, but obviously also men. And blondes or redheads. So if I have somebody walk in my office and they're a woman who's a blonde or a redhead and they're thin, white, and have blue-eyed and a fair skin, I guarantee you that the likelihood is probably 95% they have hydrocortisone deficiency. That's how strong the genetic markers are for this. Hyperpigmentation and vitiligo, these are relatively rare indications, so don't lean on those too heavily. One of the biggest causes for not having menstrual periods is hydrocortisone deficiency. A huge reason for decreased libido in women is hydrocortisone deficiency. Anytime you're having aches and pains and joint aches and muscle aches, you always got to think hydrocortisone. A hydrocortisone deficiency can cause those. Autoimmune disease, I think all autoimmune diseases from scleroderma to lupus, to rheumatoid arthritis, to colitis, you name them. Any one of those autoimmune diseases, I think they are a cortisol deficiency disease. I understand there's more factors involved than just hydrocortisone deficiency, but I know one of the big reasons people get autoimmune diseases is because they are deficient on that hormone. So in order to get well from those diseases, you have to replace your deficient levels. And of course, a low fasting blood sugar and even a low fasting cortisol on the blood test can diagnose that as well. But here's the thing, I don't want you or doctors to rely on lab tests, whether it's a saliva test or a blood test or a urine test. I do not want you in any way, shape, or form to rely on a lab test to diagnose this condition. This condition can be diagnosed in about 2 seconds by talking to a patient. And if you suspect the patient has it, it's very simple to determine if they really have it. Just give them some hydrocortisone for about a week or two. If they don't get better, they don't have the problem. But if they do get better, then there's your diagnosis. They do have laboratory evaluations, but I'll tell you, I really don't use these anymore. More often than not, these laboratory evaluations will not pick up the patient with hydrocortisone deficiency. Why? Because the general population that they're using to determine what the normal range is, they're all hydrocortisone deficient. This is a problem that is all over society. Why do you think coffee shops are so popular? So forget the tests. If you just tell your doctor, or if you're a doctor watching this, just give your patient some hydrocortisone. You're not going to hurt a patient by giving them hydrocortisone in the kind of doses I tell you about for 4 to 6 weeks. You're not going to hurt them even if they don't need it. So give them a little. Try it out. See if it works. That's the best way to diagnose any hormonal deficiency. Treating it. You want to do AM dosing. The adrenal gland makes hydrocortisone in a rhythmic fashion. It makes a lot of it in the morning, a little less at noon, a lot less around 2 or 3 p.m., and virtually none from 6 p.m. on. So you want to supplement in that way. You kind of give a dose in the morning and another dose around noontime or 2 p.m. Sometimes I'll go at 3-time-a-day dosing, so I'll do morning, noon, and 3 p.m. in the harder cases. Normally I'll just do morning and noon, and that's enough. That's what I take, and that's enough for most people. I make a powder, it's called Quick Start. You can learn about it at my website. And it's just a marvelous powder. We've used it for years and years and years. It helps your liver, it helps you detoxify, and it really strengthens your adrenal as well. So I like to use that in conjunction with the hydrocortisone. And we typically start off with somewhere around 5 to 10 milligrams in the morning, and again around 2. Now for you doctors out there, you know this is a safe dose. You know you can't hurt anybody with this. Even if they don't need it, you can't hurt it. But here's the point, this may not be enough. If you have an autoimmune disease patient, you may need in the order of 80 to even 120 milligrams of hydrocortisone. You may need a really large amount of hydrocortisone to normalize that patient. But for most patients with the typical allergies, you're looking at doses in this range or maybe a little bit higher. Often the patients need thyroid. And so We are going to talk more about thyroid, but not right now. But often the patients need thyroid. If your patient needs thyroid and they're also adrenal deficient, I would suggest that you slow down on the thyroid, because if you give thyroid hormone to a patient that's hydrocortisone deficient, you probably aggravate them with the thyroid. So hold back on the thyroid, wait till they're built up with the hydrocortisone, then add the thyroid in. Definitely take them off their stimulants. There goes the coffee. There goes any other stimulants they're taking, whether it's diet pills or medications. And definitely off the high glycemic carbohydrates. All those sugary things that they're using to make them feel better, they got to stop doing all that. But if they'll do that and take this particular remedy in here, I don't care what their problem is, inside 3 to 6 days, their whole medical condition will be completely turned around. And then you can start fine-tuning from there. You know, there's a lot of clinical conditions you also want to think about when you're thinking hydrocortisone deficiency. So anytime I have a patient who's complaining of allergies, inflammation of any kind, or any kind of illness, tiredness, fatigue, insomnia, any of those kinds of things, their bad belief systems, things that cause them to worry and stress, all those kinds of things are the kinds of things that will deplete their adrenal glands. So while we're replenishing their body with the hydrocortisone they so dramatically need, you also want to start eliminating some of the stresses that caused it in the first place. So look for food allergies, look for inhalant allergies, get rid of inflammation, clean out the bowels, give them something to help them sleep. Make sure they have good, healthy sleep habits. If they have negative belief systems, discuss that with them. Get them to look at the world as a more friendly place. We also need to teach people, when we put them on hydrocortisone, to how to dose themselves. Remember, your body makes hydrocortisone depending on how much stress you have. Because if you have more stress, you're going to need more. So for me, for example, on a regular basis, I take 10 milligrams in the morning and 10 milligrams at noon. That just does me great. But if I have to go to Europe, or I was going to Singapore there for a while, the time zones are dramatically different. That's very stressful to my body. I about doubled the amount of hydrocortisone because I needed that much. If I think I'm facing a flu or a cold, or if I'm just having a stressful time in my life, whatever the reason may be, I will increase the hydrocortisone to an adequate level. Around here we have allergy season with rabbit brush starting around September. It goes on for about 6 to 8 weeks. I'm really allergic to rabbit brush, so at that time I'll increase my hydrocortisone dose just enough that take care of those allergies. And then after the rabbit brush is gone, bingo, I can reduce the dose. So it's important for everybody to learn how to anticipate and prevent deficiency simply by taking the hydrocortisone depending on how you need it. Now, many patients, incidentally, will be able to stop it entirely. If you give them a 3 to 4 month course of a hydrocortisone replacement, that's enough time, and you deal with the causes in the first place. That's enough time for many patients, their own adrenal glands to recover, and their own adrenal glands to be making more hydrocortisone. And very often you can withdraw the hydrocortisone and they no longer need it. However, many of us, because of all the enormous stresses that we do have in our lives, such as yours truly, will probably need it to some degree forever and ever to be at optimum. I'm not saying that if you don't take it, you're going to be sick or terrible. If I didn't take my hydrocortisone, I'd just be sleepy in the afternoon. I'd probably be reaching for a coffee. I wouldn't feel the strength and the vitality and the aliveness that I feel. I wouldn't be sleeping as well. I'd be suffering more from allergies, but I wouldn't be like sick necessarily. So it's okay if you don't take it. And a lot of people worry. They've heard this myth about, geez, if I get on hydrocortisone and then I run out and I stop it, it'll kill me, won't it? No, it won't kill you. You'll just feel the way you felt before you started taking it, that's all. Remember, your body makes hydrocortisone. How bad can it be? It makes it. It needs it. If I didn't give you hydrocortisone in a pill form, you'd have hydrocortisone floating in your blood veins anyway. You make it, you need it. The question is not whether you should have some in your body. You already got it in there. The question is, do you have enough? Because if you don't have enough, your body is going to become ill and your quality of life is going to go down big time. Okay, that's a good little introductory thing on hydrocortisone. I will tell you that Most doctors, most pharmacists have no clue about anything I talked to you about. There are just a handful, probably, of physicians that understand this. I'm talking about endocrinologists too. Very few endocrinologists, which is the specialty that specializes in hormones, understand about the physiological use of hormone replacement to enhance health and optimize health. Endocrinologists are trained for disease management. Yeah, if they're used to giving hydrocortisone when the patient's got a cancer of the adrenal or some terrible disease of the adrenal. They're not used to giving it as just in replacement doses for patients whose adrenals just aren't making enough. So most doctors haven't a clue about this. And most pharmacists haven't a clue about this. And if you go on the internet or if you listen to any of these people that don't know, they'll tell you hydrocortisone is terrible, it's horrible, it's going to waste your bones, it's going to give you cancer, it's going to give you diabetes, God knows what they tell you. It's true, all those things will happen if you take enormous doses year in, year out. If you take doses way beyond what you need year in, year out, all those things will happen. That's true. But we're not doing that. We're just giving you what you need. If you're supposed to have that much, but you're only making that much, we just give you the difference. We don't give you that much. So all those warnings, I tell you what, if those warnings were true, there would be thousands of my patients out there that are just sick and diseased and horrible instead of feeling great, because I've been doing this for decades. Now we're going to talk about something that is really tightly aligned to adrenal, and that is the thyroid. Keep in mind, there's sort of this triad in the body that orchestrates healing. Okay, one part of it we've just talked about is the adrenal part, the hydrocortisone part. And I don't know that I mentioned this, so I will mention it. Let me see if I said this. No, actually I didn't. Okay. So I do want to mention this. When you're taking hydrocortisone, I always give some DHEA with it, dihydroepiandrosterone, which is the other hormone the adrenal gland makes. DHEA balances out. It's a stress hormone too, but it attacks the stress in a different way. So DHEA balances out hydrocortisone, so give them together. Normally I'll give milligram for milligram, equal amounts of DHEA and hydrocortisone whenever I'm dosing. So I forgot to say that, so I want to include that in there. So on the one hand, you have this triad now. On the one hand, you have adrenal hormones, primarily hydrocortisone and DHEA. The other part of the triad is the thyroid hormones, T3 and T4. And then the third part of the triad is the big organ that regulates all of this. It's called the liver. So that's why we take the Quick Start powder, because it's a liver remedy. And that's why we always think of doing those three. We always think of taking liver remedies along with hydrocortisone and DHEA, along with T3 and T4, the thyroid hormones. And incidentally, iodine is used by all those, so we throw a little iodine in there. So that's kind of the overall big approach to giving your body the main ingredients that it needs to get well. So we're going to take a little time here. We're going to talk about hypothyroidism. Hypothyroidism is another one of these things. It's kind of like, it's prevalent almost as much as hydrocortisone deficiency is. Thyroid hormone deficiency is prevalent like that. But your doctor will miss it, your conventional doctor will miss this most of the time, because all he ever is going to do is check a blood test called a TSH, which, as you will see, I'm going to explain the blood testing part to you, and you'll see that the TSH is essentially useless for diagnosing this condition. And we're going to talk about how you can diagnose this condition, how you can treat this condition in a second. But I think it's critical to understand that as we get older, thyroid hormone deficiency is an inevitability. In fact, as you get older, every hormone that you have inevitably will become deficient. It's true, there's a great deal of difference. I saw like a 72-year-old man yesterday, and his testosterone levels were perfectly normal. They were really good. And relatively recently, I saw a 42-year-old man, his testosterone levels were in the dumper. So there's a great deal of variation here. But whatever age you are now, 10 or 20 years from now, your thyroid levels, your adrenal, your hydrocortisone levels, your testosterone levels will all be lower than they are now. We know this. So over time, people become deficient in hormones. Now, thyroid hormone is a little bit different than hydrocortisone. Hydrocortisone becomes deficient due to stress. So it can be deficient in an 18-year-old kid if he's got sufficient stress. Thyroid hormone becomes deficient usually more over time. However, we all know that people can be born with thyroid hormone deficiency. So if they can be born with thyroid hormone deficiency, then we know as they get older, it's become more and more prevalent. And so we do see a very broad spectrum, and this is the kind of a hormone deficiency, along with hydrocortisone deficiency, that can occur even in young people. So we always think about this, even in 20 and 32-year-olds, thyroid hormone deficiency. Well, if you look through the whole list of thyroid hormone deficiency symptoms, it encompasses almost anything that can happen to you that's out of the ordinary, but I'm just going to give you the main ones. You feel weak, you're not quite as strong, you're tired, you're run down, you might be sleepy even during the day. Your cognitive dysfunction, your brain won't work as well, you're not quite as sharp, you can't concentrate quite as well, you don't remember quite as well. It might be hard for you to learn things. Mood is a big one. You can start becoming depressed. Low thyroid is a major cause of depression, particularly in the elderly, but also in the young. Slow wound healing. If you find that your wounds don't quite heal as well. If you find that you get infections easily. This is particularly true with colds and flus. So you're the kind of person that gets all the colds and flus, you're probably thyroid deficient. Cold and heat intolerance. So that's another one we see. If you can't tolerate the cold, you're putting on sweaters and everybody else is looking at you funny. Or you're taking off all your clothes because you're too hot and everybody's looking at you all kind of funny, then you might very likely have thyroid hormone deficiency. A decreased appetite, diminished libido, particularly in women, but this is one of the major causes for lack of sex drive in women. And in men, impotence. In women, a major cause of anovulation or not having periods or irregular periods, PMS, anything to do with your periods, women. If your periods are off, you get PMS, you get bad cramps, they're irregular, you skip periods, any of that kind of thing, think thyroid. You're probably thyroid hormone deficient. Dry eyes, a common cause. So there's so many people have dry eyes today, and instead of just taking drops for them, look into your thyroid because you probably have thyroid hormone deficiency. Constipation, a major symptom. Your bowels need to be moving every day. If they're not moving at least every other day, you probably have thyroid hormone deficiency. Joint aches, arthralgias, headaches. I've seen several patients with chronic, severe, bad migraine headaches. Put them on some thyroid hormone, bang, gone forever. That was their cause. A Raynaud's phenomenon, which is a disorder of the fingers. Carpal tunnel syndrome responds really well to low thyroid or to thyroid replacement. Okay, so those are some of the symptoms that you can use to recognize if you have this. So now the next part is to determine if you have it, and we can rely on laboratory testing. So I'm going to go over here to the chalkboard, and I'm going to give you I'm going to show you basically, explain to you what I would tell you probably 95% of doctors don't know about thyroid testing, including most endocrinologists. So this will be a great little lesson for you. And once you see this, you'll really learn how you can diagnose thyroid, and then we'll talk a little bit about how you can treat it. Okay, so before you can understand much about how the testing is done and much about how you ought to be treated, here's some really critical things to understand. I'm going to diagram out for you how this whole thyroid axis works. It's really simple, so just follow with me on this. You know, it all starts with your cell down here. Okay? All of your cells, every single one of your cells requires energy to work. Doesn't make any difference if it's a brain cell or a hormone cell or an enzyme cell or whatever the heck it does. It needs to have energy to work. The ability for the cell to make energy is what we call metabolism. If you have a fast metabolism, you make plenty of energy. If you have a slow metabolism, you don't make enough energy. So the body's ability to regulate the metabolism of the cells is absolutely critical to health. Let me give you an idea how critical this is. If you don't have any metabolism, it's easy to diagnose your condition. It's called dead. So you need to have adequate metabolism. If you have slow metabolism, it's easy to diagnose your condition too. It's sort of like almost dead. You're tired, you're run down, you know what I'm talking about. So anyhow, cell metabolism is what it's all about. Now up here you got your brain, and here's what the brain is responsible to do. And the brain is the conductor of the symphony. He's supposed to understand what the hell is going on in the cells. So the brain monitors the cell, and the brain notices what the cell's metabolism is. If the cell has a good metabolism, the brain says, fine, everything's good. But if the brain says, you know what, the metabolism on the cell is starting to get a little bit low, then the brain goes into the following. It sends a message down to the thyroid gland. And that message is a hormone called TSH. TSH stands for thyroid stimulating hormone. So it's not actually a thyroid hormone. But what it does is it stimulates the thyroid to make hormones. So now the thyroid, when it gets exposed to this TSH, now is going to make hormones. So it's going to make a hormone called T3, and it's going to make a hormone called T4. Now the difference between T3 and T4 is they're the same hormone, except T3 has 3 iodine molecules, atoms on it, and T4 has 4 iodine atoms on it. So other than that, they're the same. The thyroid, what it does is it makes roughly about 85% T4 and about 15% T3. So it doesn't make much T3. It makes mostly T4. Now T3 is the active form of the hormone. T3 is what actually goes down to the cell and stimulates the metabolism. T3 tells the cell to speed up. So when the brain finds out that the metabolism is going low in your cells, it signals the thyroid to make these hormones. The thyroid makes a little T3, and that little T3 activates the cells to increase the metabolism. Now you might ask, well, why is it making T4 then? What's that all about? Well, here's the deal. T4 is inactive. It means it doesn't do anything. It's unable to stimulate the cell. But what T4 can do is, it can get converted to T3 on an as-needed basis. So basically, T4 serves as kind of a reservoir of hormones that are inactive, but they can be activated at any moment, depending on whether your body needs it. So let me give you an example. Let's say I'm lifting weights, and I'm lifting weights with my right arm. The cells of my right arm need to have a much more rapid metabolism than the cells of my left arm, don't they? So how's the body going to do that? It can't do that by the thyroid, because that's going to treat the cells in the whole body. It has to have a way of just treating the cells with more thyroid in this right arm, and this is how they do it. All my T4 in the right arm will be converted to T3, and that's one of the ways that it can regulate that. So T4 gets converted to T3 on an as-needed basis. The thyroid, in its wisdom, makes only about 15% T3. That's sort of enough T3 to generally keep you awake and alive and things functioning. You know, you need T3 even when you're sleeping, right? You have a certain amount of metabolism when you're sleeping, even though it's much lower. So you make the thyroid makes just enough T3 to kind of keep things going. And then when you have a more need for T3, say if you're fighting an infection or you're exercising or you're heavily involved in thinking or whatever you're busy doing, and you need a higher metabolism, on an as-needed basis, your body can convert T4 to T3. If in general your body needs more, it can also convert it in the liver. So I told you before that the liver was a master player in hormone regulation, and it is. It's in the liver predominantly that T4 gets converted to T3. However, and here's something that a lot of people don't understand, T4 can also get converted to something called RT3. R stands for reverse. So what RT3 is, it's a molecular form of T3 that's just slightly backwards. Okay? Now the problem with RT3 is it's inactive. It doesn't do anything. It can't stimulate the cells to increase metabolism, but since it's molecularly same as T3, it can interact with the receptor sites on the cell. So it can go into these receptor sites that should be activated by T3, and it can attach onto them. When the RT3 attaches to the receptor sites on the cell, that means that real T3, the active form of T3, can't. So RT3 has a negative effect on metabolism. The more RT3 you have, the more that you block your real T3 from working, and you can't get a metabolic improvement. Now here's why this is important. So many doctors look at this complex situation here and diagnose whether or not the patient needs thyroid based upon this. Well, you know, anybody can look at this and say, well, that's kind of ridiculous. That's looking at a very complex system and only checking one single regulatory aspect of it. What if the thyroid is making plenty of T3 and T4, but you can't convert here? What if the thyroid's making plenty of T3 and T4, but you're making too much RT3? This completely ignores this point. So what you need to do from a blood test, if you really want to know what's going on with the thyroid, you got to get TSH, T3, T4, and RT3. If you get all four of those, now at least you have some idea of what's going on down here at the cellular level. But here's the bummer. You don't even know then. You don't even know then. You could get all of these, and they all fall within the normal range, and the patient is still hypothyroid. So, how do you determine if the patient really needs thyroid? You look directly at the metabolism. You look directly down here. You measure the metabolism directly. This is something very few doctors do. I've been measuring metabolisms directly for almost 15 years now, and I can tell you from doing that many times, almost all the time that the cell has hypometabolism or low metabolism, almost all the time the TSH is normal. I would say 95% of the time. So TSH, in my opinion, misses the diagnosis 95% of the time. The other thing is that almost all the rest of the tests are normal, say 60-70% of the time. So these tests are not a good way to diagnose whether you really need thyroid. The way to diagnose this is with getting a basal metabolic rate. Now, you can measure this. Again, most doctors don't do it, but there are ways to measure basal metabolic rate. We use a technique called indirect calorimetry. If you read any of my books, I have 2 books out, Bursting with Energy and the Type 2 Diabetes Breakthrough. You read any of those books and you'll learn about bioenergy testing, which is how the testing system that scientifically can determine what your metabolism is. If you also go to the other section on this website and click on the button that says bioenergy testing, you learn more about it too. And I have like a lot of videos out on this, so you can click any of those videos. But they will describe how bioenergy testing will directly tell you how your metabolism is working. Now, that's important because without that, you're probably going to have the diagnosis missed. You're probably going to have all the symptoms of low thyroid, and you're probably going to go see your doctor, and they're probably going to tell you don't need thyroid when you really do. Now, there's another reason to know this scenario, because there's 2 ways to give thyroid. Once you've determined you need thyroid, most doctors, the way I was taught in medical school, is just give T4. Examples of the medication T4, the thyroid hormone T4, would be Synthroid, levothyroxine, and there's another one, but I can't think of it right now. But Synthroid is the most common. It's also called levothyroxine, and that is simply T4. So most doctors will give T4, and their reasoning is good. The reasoning is, you know what? Why give T3? It's active. Maybe the patient doesn't need T3. Let's just give them T4, and then when they need T3, they can always make it from the T4. Well, that makes sense, doesn't it? And that's why doctors give T4. Here's the problem. Very many patients, they don't convert well from T4 to T3. They just don't. I don't really know why, but they don't convert well. You can give them T4 all day long. They just don't make T3 out of it. But it gets worse. A lot of these patients not only don't make T3 out of their T4 they're getting, they turn it into RT3. So not only are they deficient in T3, now they're getting too much RT3, and that RT3 is ruining the little T3 they have left, and actually these people feel little if no response at all from Synthroid or levothyroxine. How are you going to know? Well, you know is if I see a patient and they're on Synthroid or levothyroxine, I test all 4 of these things. Of course, and I also test their metabolism. If their metabolism is low, which it almost always is, and especially if their RT3 is high and their T3 is low relative to T4, I know they're on the wrong medication. So we switch them over to something called desiccated thyroid. Examples of desiccated thyroid would be Nature Throid or West Throid, or Armour Thyroid. Armour Thyroid and West Throid consists of combinations of T3 and T4, and they tend to solve the problem a lot better than Synthroid. Sometimes that doesn't even work, and sometimes we need to have specially made combination thyroids that are custom made for each patient, which really accentuate T3, because if we give you T3, you can't make our T3, and that causes the whole system to work really well. So it's not just about diagnosing, it's also about learning exactly what preparation of thyroid to give. But once you get that nailed down, you get your adrenal activity nailed down, you get your thyroid activity nailed down, you are well on your way to becoming healthy, and I hope the information from this lecture has helped you in that regard. So here's to your good health.